Hello, I'm Dr. Adriana Potter. Don't Let Pain Drive You Insane series. Today, we're going to talking about some topicals for pain management. A lot of my patients ask me, do topicals really help? And the question is, it depends, okay? One thing I can tell you, it won't harm. So you will never know until you try. But the most important thing that I find it with the topicals is that why for some people they feel like it really helps. First of all, let's talk about understanding what is your body perceiving, okay? So when you do a topical, it creates a new sensory input, a new sensation, right? That new sensation is immediately noticed by your brain. And because your brain has what's called locus of attention, means that you will pay attention to the strongest and the most recent stimulus, right? And if you're adding something that it create that thermal sensation, or even the fact that you're rubbing the muscles, that is a new sensory input, and your brain will pay attention to that instead of paying attention so much to the pain, okay? Your pain is still in there, it's just your brain now is not paying attention to it as much. Another thing that I tell my patients with the topicals is that it creates, many of them create like a thermal sensation. Some will become like cold and some will become like a little heat, right? We have the icy hot and the biofreeze. They kind of can become a little cold, like menthol. All the menthol based topicals also have, if you notice that a lot of the CBD and hemp creams have menthol in it, and in addition to having a little bit of that anti-inflammatory properties of the CBD, of the hemp. So when they create a thermal sensation, the funny thing about the brain is that not only is paying attention to the new sensory, but temperature travels on the same pathway as your pain. It's the same, it's called spinothalamic pathway. And the sensory inputs that you get, it goes on the same pathway. So you actually, it kind of gets the pathway busy with the new sensation, so it doesn't send as much as the pain sensation into your brain. So because it's the strongest one, your brain will tell you, no, let's let this come in because it's a new one, we need to see what's this going on. So your brain is actually the one who's doing most of the work, okay? But it's kind of working like a gate, right? It's shutting down the gate for pain and opening the gate for the sensation of the thermal effects or the new sensory input. Regarding topicals, I usually divide them into the medicated topicals and the non-medicated topicals. So I did some research trying to find out any evidence on topical creams and the effect of pain, okay? And the research that is out there is only on the medicated ones, which is the Capsacin, Voltaren, or also known as diclofenac, and the lidocaine. They usually, the Voltaren is an anti-inflammatory and the lidocaine is an analgesic, and the capsaicin, it will work like analgesic, and to some degree is also anti-inflammatory mediator, anti-inflammatory mediator. And the research shows that capsaicin and Voltaren, people have the best response on decreasing that pain level, and they are medicated, okay? Now the non-medicated ones is those that you find more easily on the counters. There's a series of them. I made a list, and hopefully, yeah. People have told me they use essential oils like peppermint, eucalyptus. Tiger balm is one of the top ones out there that people use. Salon pass, hemp creams, CBD creams, menthol based like biofreeze, arnica, and of course in the Voltaren, capsaicin, and lidocaine. Those are the ones that is being out there. I personally have used the emu cream, not so much. I like the CBD hemp one. I'll put the link for you down in comments for it. My patients really love that, and I offer that for my patients if they wanted to have as a soothing at the end of our manual therapy, and I recommend that for pain management at home as well. Because the CBDs have the anti-inflammatory mediators similar to the capsaicin, and it can help with the pain and decreasing. But it always, they have most of them have menthol, and it creates that thermal sensation. But in general, the topical is a combination of creating that new sensory input, okay, accompanied by some soft tissue that helps you because it's also sensory input, right? And occupying your brain with a new sensory input, and it will help you to decrease a little bit of that attention to the pain and paying attention more to the new input, sensory input from the topical ones. Okay, hopefully this helps. I always tell my patients, make sure that if you are using capsaicin, use gloves because it's a pepper base and it really kind of impregnates on your skin. So if you rub your eyes or your mouth, it's gonna burn because it is a pepper. So make sure to use gloves and don't rub it too much. Just put it on and leave it in there. Do not use any heat or cold after capsaicin because the area that you apply becomes extremely sensitive. So I would not recommend any cold. With the Voltaren cream, no rubbing, okay? Because it is a gel alcohol base. So you want to do maybe some manual therapy, use some heat and cold, and then put the Voltaren and leave the skin naturally absorb that. If you rub it too much, the alcohol will dry it out very fast, and the absorption of the Voltaren or the diclofenac will not absorb as much. With the lidocaine, it's the same thing, okay? The patches are good because, you put it in and leave it, you're not touching anymore. So I like those patches as well. With the menthol, I always say like rub it with oils, do all the massage that you want to do it, and then your topicals can go in as a soothing effect for your painful area, and also helping with that brain desensitization, which is making your brain paying less attention to the pain and helping you to manage that a little bit more. Okay, so that is it on the topicals. The future videos, we're gonna go over a couple more things. The next one, we're gonna talk about using electrical stimulation units. So hopefully pay attention for that video, look for into it. If you have any specific request for videos and have any questions, or please don't hesitate to put it in the comments and so I can address them and help you out with those videos. I'm Dr. Adriana Potter. And don't let pain drive you insane. We cover the use of topicals for pain management. Don't forget to subscribe and press the bell button for your future videos.